Welcome to Health Prime International. We're going to do a short video with you outlining some of the services that we provide at HPI. First of all, we work with physician practices throughout the United States, offering the most comprehensive menu of services and support available to physicians to help them with their practices. Why do people choose HPI? We have a multidisciplinary executive team. Our management have expertise in clinical medicine, healthcare management, engineering, computer science and IT infrastructure, finance, marketing, business development, facility planning, and practice management. Right now, we've got over 600 team members, 2 back office service centers in Mumbai, India. We provide services throughout the United States, and we're currently serving over 600 physicians headquartered in National Harbor, Maryland, with the U.S. regional offices in Fort Lauderdale and Atlanta. Here's a menu of some of the services that we do provide, which we've all labeled under our Prime Business Solutions label. We start off with Prime Revenue, which is managing the back office functions of billing and collections, essentially billing and collecting and making sure that practices' cash flow keeps up with their expectations. Typically, we're able to save our clients 40% on the costs of managing their revenue cycle. We assist our clients with electronic health records, EHR. We assist them with decision support, organizational development, implementing the electronic health record, as well as making that workflow very efficient. Prime Quality includes our umbrella of services for supporting quality and compliance initiatives such as coding, reviews, and compliance programs. Prime Consult is our ability to work with physicians and practice owners on practice development such as improving their technology infrastructure, business development, strategic and business partnership and planning, asset management, and we also do management services organization and accountable care organization development. That's MSO and ACO development. Prime Project is our tool for being able to manage all of our various projects that we have going on at any one point in time. Prime Meeting is our online meeting space using WebEx, where we're able to meet with our clients as well as have internal meetings to make sure that we're on the same page and track our progress as we work through our daily business affairs. Prime Contact is our services for providing support for such things such as appointment confirmations, health maintenance calls, and helping to make sure that those patients that are scheduled to be in the office are showing up in the practice and are there on time. Transcription, we manage in several ways, traditional transcription as well as scribing transcription, where we're actually taking the voice files of the physician and transcribing them directly into an electronic health record. PAQ is just our way of working with the physicians on their action cues within an electronic health record. And what differentiates us from others in this business is our 8-step process for revenue cycle. We start off with helping the practices maximize their productivity. That includes scheduling efficiency, how they utilize their resources. Those resources could be physician time, it could be space, it could be equipment they own. That's sending out the appointment reminders or contacting patient with voice-to-voice appointment reminders and doing health maintenance protocol. Typically, we can add 5 to 15% to practice income by focusing on some productivity enhancement. Then we look at charge capture, which is making sure all encounters are billed, that all services that were provided are billed. We have a vigorous quality control process to make sure that all of our data entry is accurate, and we post all charges within 12 hours. Many practices might be losing anywhere from 1 to 3% of their revenue through poor workflow processes. Coding accuracy, this goes to Prime Quality, where we look at the evaluation management level of service. We look at surgical and other procedures done in the office or hospitals, diagnosis linking, modifiers, global periods, risk mitigation. We find physicians are more likely to undercode than overcode, which means that they're losing revenue simply because they're not claiming the true value of the work that they're performing. Our goal is to submit all claims clean on the first pass. We want to validate insurance eligibility, do proper and appropriate pre-claims edits, manage referrals and authorizations, and ensure that all claims are filed timely. And then we work on AR management, which is following up on any insurance claims that have not been paid, making sure that when we post transactions, any adjustments we post are accurate and proper, looking at balance control issues, credit balances, denials, and appeals. Our standard for days in AR is less than 30, and that means that any of our practices should have less than 30 days worth of their charges sitting in accounts receivable. Then we move on to patient financial services, which is working with patients to collect the patient co-pays and deductibles, the patient portion of the responsibility, managing patient statements, sending out dunning letters, follow-up phone calls, bad debt management. All of our fees to our clients are inclusive, so we don't have any additional charges for sending out statements, letters, etc. They're all included in the base fees. And what really separates us from the pack are our analytics. We are very transparent with our reporting, which means we show our clients everything. They have access to everything. So if there are any problems, they're going to see it and we're going to show them. And our expectation is that as we identify problems with processes or workflow, that we identify those early, correct those early, and that the practice doesn't suffer because of any mistakes that might have been made. We assist the practices with evaluating their payer contracts as well as trending and forecasting models to help them understand if their business is going in the right direction and helping them make the right decisions to get it there. Finally, decision support, using the analytics to help the practice develop new products and services, improve process, negotiate new contracts with payers, and assist them with any strategic planning initiatives they might have. We want to help them make smart decisions with confidence. We also provide services for MSO and ACO development. Essentially what we do is we work with groups of physicians as opposed to individual practices, and with large group of physicians, MSOs could have anywhere from 200 to 300 physicians. We provide our suite of services for that group of independent physicians either through the MSO, the Management Services Organization, or the ACO, which is the Accountable Care Organization.